Welcome to the deep dive. Today, we're taking your sources, research, articles, notes, and really boiling them down. We're tackling a challenge that, well, a lot of horse owners run into, sometimes without really knowing it. Equine Inflammatory Airway Disease, IAD. You might also hear it called mild to moderate equine asthma.
That's right.
Picture this. You've got a performance horse, maybe a jumper, looks perfectly healthy, but just isn't quite performing. Or maybe there's this little cough that just hangs around, especially when eating or warming up.
It's surprisingly common.
Yeah, so this deep dive, it's basically a shortcut. We're pulling the critical info straight from the vet sources to help you understand this thing that's often kind of misunderstood.
Yeah, our mission today is really to get past thinking these are just minor breathing things.
Yeah.
We want to unpack the subtleties of IAD, how vets actually diagnose it, and crucially, the huge role the horse's environment plays in keeping these athletes healthy and performing. And we'll also touch on how this IAD, the milder form, differs from what people used to call HEAVES, which is now termed severe equine asthma.
Right, okay. So let's unpack IAD itself. What is it, fundamentally?
Well, at its core, it's a non-septic inflammation. So think irritation, not infection, down in the lower airways.
That's a really key point, not an infection. It's this inflammation that leads to extra mucus. And for performance horses, that means a drop in athletic ability, straight up.
Exactly. And, the terminology has shifted. Equine asthma is now the umbrella term covering these non-infectious inflammatory issues. IAD is the mild to moderate type. HEAVES is the severe end.
Okay.
So pathologically, what's happening is the horse becomes overly sensitive to things in the air. Dust, mold, pollen, that sort of thing.
Everyday stuff, really.
Pretty much. And when they breathe this stuff in, their immune system down in those small airways, the bronchioles, it kind of overreacts.
Yeah.
It sends in inflammatory cells, neutrophils, mast cells, eosinophils sometimes. And these cells release mediators that cause inflammation, mucus production, thickening of the airway walls.
Yeah.
Basically gunking up the works and making it harder for air to move, especially when the horse is exerting itself.
And this isn't some, super rare condition either, is it?
Oh, not at all. It's incredibly widespread, especially in horses that spend a lot of time stabled or are trained indoors.
Right.
We see it everywhere. North America, UK, Australia, Iceland, Europe. Any breed can be affected, and usually it pops up between the ages of 1 and 12.
So it's really the respiratory system, those smaller airways, the bronchioles, that are the target here, not the deeper lung tissue.
Exactly. The peripheral airways are the main site. The alveoli, where the gas exchange happens, are generally okay in IAD. And interestingly, you might think genetics would play a big role.
Yeah.
But we haven't really pinned down consistent breed or sex links for IAD specifically.
Okay, this is where I think it gets really fascinating for owners, because the signs, they can be so subtle, right? For that performance horse we mentioned, the biggest clue often isn't gasping for air. It's more like reduced exercise tolerance or just, poor performance and maybe taking longer to recover after work.
Precisely. That's often the main complaint.
Mm.
You might also see an intermittent cough, maybe more noticeable when they're eating hay or just starting exercise. And sometimes a little bit of clear, watery nasal discharge, especially after they've worked. But here's the really key difference from more severe conditions.
What's that?
Horses with IAD typically show no increased breathing effort when they're just standing around at rest.
Okay, that's important.
Yeah. And usually no fever, no acting depressed or off their feed. Vitals are generally normal, although maybe a slightly high resting respiratory rate sometimes, or just that prolonged recovery time you mentioned.
So if the horse seems pretty normal, just chilling in the stall, what does a vet actually do during an exam? How do they pick up on these subtle clues?
That's a great question. Because, often listening to the lungs at rest, they sound completely normal. So a really important step is often the rebreathing examination. The vet puts a special bag over the horse's nose for a short time.
Right, I've seen that.
Yeah, it makes them breathe deeper, right?
Yeah.
And that can bring out abnormal sounds like crackles or wheezes that weren't there before, or it might make them cough.
Ah, okay. So it sort of stresses the system a bit to reveal the problem.
Exactly. And sometimes tapping on the chest, percussion, might reveal hyperresonance, which suggests some trapped air. And of course, the history is huge.
Right.
The vet's going to be asking, is it dusty? What's the ventilation like? Is the hay maybe a bit moldy? Any recent respiratory bugs going around the barn?
Okay, so we've got these subtle signs, the history.
Yeah.
But what's the actual root cause? What's triggering this inflammation?
It's mainly a combination of things in the air. Airborne allergens and endotoxins are the big ones.
So like mold and dust from hay and bedding.
Yep. Especially if the hay quality isn't great or if they're bedded on straw, which can be dusty. And then you've got noxious gases like ammonia building up from urine and manure in the stall.
Yeah.
Those inhaled irritants are really the primary drivers.
And are there specific risk factors that make a horse more likely to develop IAD?
There are. Things like previous respiratory viral infections,
Yeah.
equine influenza, equine rhinitis viruses, or even bacterial bronchitis, especially in younger horses, can sort of prime the pump or make existing inflammation worse.
Okay.
We also tend to see it more often during hot, humid weather. And horses in intense training, like race horses, seem to be at higher risk too.
Interesting.
The exact link between viruses and causing IAD is still being looked into, and there's also some thought that it might sometimes develop after a horse has had bleeding in the lungs, EIPH.
So diagnosing this, it sounds like it's not always cut and dried because the signs are subtle and could be other things too.
Yeah.
How do vets really nail down that it is IAD?
Right, it requires digging a bit deeper than just a physical exam. Basic blood work like a CBC or chemistry panel is usually completely normal. Doesn't really help much.
So you need specialized tests.
Exactly. The main ones are bronchoscopy and, crucially, what's called bronchoalveolar lavage fluid cytology, or BALF.
BALF, that sounds intense.
Well, it's the gold standard.
Yeah.
We pass a scope down into the lungs, wedge it gently in a small airway, flush in a small amount of sterile saline, and then immediately suck it back out.
Okay.
This collects cells and fluid directly from those small airways where the inflammation is happening. Gives us a real snapshot.
And what are you looking for in that fluid?
We analyze the types of cells. The key finding in IAD is usually an increase in neutrophils. Those are a type of inflammatory white blood cell. Often they're above 5 or 10%, whereas a healthy horse usually has less than 5%.
Gotcha.
Sometimes we see more mast cells or eosinophils too. And importantly, if we culture the fluid, there are usually no significant bacteria, maybe just some random stuff from the environment. That helps rule out bacterial pneumonia.
And you mentioned bronchoscopy too, seeing inside.
Yeah, that's usually done first. We use the endoscope to look down the trachea and the larger airways. The main thing we often see there is just excessive mucus. We actually grade how much mucus there is. And the scope exam also lets us rule out problems higher up in the airway that might be causing similar signs. While you can do a tracheal wash, which samples higher up, the BALF is much better for IAD because you get samples from deeper down where the IAD action really is.
Are there other tests, like x-rays?
Chest x-rays, thoracic radiography generally have limited value for IAD specifically. You might see some subtle changes sometimes, but it's not the go-to. Lung function testing exists, but that's usually only at specialized referral centers. Lung biopsies are almost never done for routine diagnosis.
So with all the things that can cause a cough or poor performance, how do vets differentiate IAD? Like, how do you know it's not heaves or pneumonia or bleeding?
Good question. Differentiation is key. So compared to severe asthma or heaves, the big clue is no increased breathing effort at rest in IAD horses. Bacterial pneumonia. We usually see fever, the horse feels sick, and the BALF culture would likely grow bacteria. IAD horses typically don't have those signs.
Okay.
EIPH or bleeding. We'd see blood or specific cells called hemocytophages on the scope or in the BALF. Viral infections usually come with fever and other signs too, and things like obstructions in the upper airway are ruled out during the endoscopy itself.
Makes sense. And what about long-term changes? Can IAD cause permanent damage like heaves can?
That's a good point. We talk about airway remodeling, permanent structural changes in severe asthma. While persistent inflammation can cause changes, it's generally considered less severe or well-characterized in IAD compared to heaves.
Okay, so we've diagnosed Bella, our jumper, with IAD. What now? What's the treatment plan look like? The goal seems clear: reduce inflammation, help her breathe easier.
Exactly. Control inflammation, improve lung function, reduce that mucus and airway twitchiness. But, and this is the absolute critical piece,
Let me guess. Environment.
Environmental management is imperative. I really can't stress that enough.
Why is it so crucial?
Because without changing the environment, any medications are basically just a temporary fix, often not even that effective. The horse is just constantly breathing in the triggers again.
Right. Makes sense. So what are these key environmental changes?
Number 1, maximize turnout. Ideally, 247 on pasture, if possible. That dramatically cuts down exposure to dust and allergens inside a barn. Outdoor living with just an open shelter is great.
Okay, get them outside. What about feed? Hay is often dusty.
Huge factor. Soaking hay for about 15 to 30 minutes before feeding helps reduce dust and mold spores significantly.
Uh,
Steaming hay, using a proper hay steamer, is even better. Really effective.
like those Haygain steamer.
Exactly. Other options are things like haylage or wrapped forage, which are low dust, though there are some botulism concerns sometimes, especially here in North America. Or you can switch entirely to pelleted or cubed feeds.
And how you feed it matters too.
Definitely. Feed from the ground. Avoid those high-up hay nets where the dust just falls right into their breathing zone.
Good tip. What about bedding? Straw can be dusty too.
Absolutely. Switch from straw to low-guest options. Think wood shavings, paper, cardboard, pelleted bedding. Rubber mats with something absorbent underneath are also excellent.
And ventilation in the barn.
Crucial. You need excellent airflow. Open windows, doors, use fans if needed. Stagnant air traps, irritants.
Makes sense. What about barn chores? Cleaning stalls, sweeping. That kicks up dust.
Big time. Always take the horses out of the barn, doing cleaning, sweeping, even feeding. And here's a big one. Absolutely no leaf blowers inside barns.
Oh, wow. Yeah, that would be bad.
Terrible. And wait maybe 30 to 60 minutes after chores before bringing horses back in. Let the dust settle. Keep stalls clean, remove manure and wet bedding frequently to keep ammonia down, and store your hay, ideally in a separate building, away from where the horses live.
That's a lot of management changes, but it sounds like they're non-negotiable.
Pretty much. They are the foundation of managing IAD.
Okay, so with those environmental changes in place, what about medications?
Right, medical management complements the environmental changes. The mainstays are corticosteroids. These are powerful anti-inflammatories. They calm down that overactive immune response in the lungs.
Okay. Like pills or shots?
You could use systemic ones like oral prednisolone or injectable dexamethasone, especially for initial flare-ups. You usually taper the dose down. But the concern there is potential side effects with long-term use, like laminitis risk.
Right. Always a worry with steroids.
Exactly.
Yeah.
Which is why for managing IAG, especially in performance horses, inhaled corticosteroids are often preferred. Things like fluticasone, beclomethasone, butzenide.
Like an asthma inhaler for people?
Precisely. Delivered via a special equine inhaler mask, MDI, or a nebulizer.
Yeah.
The beauty is the drug goes directly to the lungs.
So fewer side effects.
Way fewer systemic side effects. It's much safer for long-term use, and bonus for competitors. They usually have shorter withdrawal times. Plus, they're safe for pregnant mares late in gestation.
Okay, that sounds like a big advantage.
Yeah.
What else?
Bronchodilators. These drugs relax the airway muscles, opening things up quickly. They provide rapid relief.
Like a rescue inhaler.
Sort of. You have oral options like clenbuterol, or inhaled ones like albuterol, salbutamol, or ipratropium. They work fast, but they don't treat the underlying inflammation.
Ah, so they help symptoms but don't fix the cause.
That's correct. They're often used before giving the inhaled corticosteroid, actually. The idea is to open the airways first, so the anti-inflammatory medication can get deeper into the lungs.
Clever. Anything for the mucus.
Yes, sometimes mucolytics or expectorants are used. Things like nebulized acetylcysteine or oral dembrexin can help break down thick mucus and make it easier for the horse to clear it.
Okay.
And finally, there's growing evidence for omega-3 fatty acid supplementation from flax or fish oil. It seems to have some anti-inflammatory effects that can help improve the clinical signs.
What about antihistamines, if it's allergy related?
You'd think so, but they generally have pretty limited effectiveness for IAD in horses, unfortunately.
Huh. Okay, so it really is a combination approach, heavily leaning on that environmental management plus targeted meds.
Absolutely. And owner education is huge. They need to understand why these changes are important and stick with them. Keeping up with respiratory vaccinations is also good practice for general lung health.
And if managed properly, can the horse, return to full work?
Yes, generally, with proper management, there shouldn't be any limitations on their activity level.
How do you track progress? Just seeing if the cough stops?
Observing signs is part of it, sure. But vets might also do repeat endoscopy to visually check if the mucus in the trachea has reduced. And sometimes a repeat BALF cytology can objectively measure if the inflammation, those cell counts, have actually decreased.
All right, so let's talk prognosis. If an owner does all this, makes the changes, uses the meds, what's the outlook for a horse with IAD?
The good news is the prognosis is generally good to excellent for controlling the signs and allowing the horse to return to its previous level of athletic performance.
That is good news.
But, and it's a big but, that positive outlook depends entirely on consistent, effective environmental management and the owner really sticking with the plan.
Ah, so it's not a cure, it's management.
Exactly. IAD is considered a chronic condition. The horse might always be sensitive. They might need those environmental changes permanently and potentially intermittent or even long-term medication, especially if they get re-exposed to dusty hay or poor air quality.
So relapses are possible if things slip.
Very likely, yes. If the environmental control isn't maintained, the signs will probably come back.
And what's the flip side? What if it's not managed well?
Well, if it's untreated or poorly managed, there's a risk that IAD can actually progress to the more severe form of equine asthma RAO, or HEAVES, and that carries a much more guarded prognosis. Severe asthma can lead to irreversible changes in the lungs. So catching and managing IAD early is really important. It's often thought to be more transient in younger horses, but you still need to be vigilant.
So early diagnosis, mainly through that BALF and scope, is key. And then it really comes down to the owner's commitment to reducing those irritants.
That's the bottom line.
Yeah.
Long-term success truly hinges on minimizing what the horse breathes in day to day.
Wow, that was a really thorough deep dive into IAD. It definitely highlights how something that seems kind of minor, like a little cough or being slightly off performance-wise, can be significant, and just how powerful understanding the cause, often the environment, can be.
Absolutely. I think the core lesson, really, it goes beyond horses, doesn't it? It's about how much our immediate surroundings can impact respiratory health, whether you're an equine athlete or, well, any of us.
Yeah.
It really hammers home that sometimes the best treatment isn't found in a bottle, but in changing the environment itself.
Exactly. Which leads us nicely to our final thought for you, the listener, to chew on. It's something seemingly small, like dust in a stable, can have such a big impact on a horse's ability to perform. What other hidden environmental factors might be subtly affecting our own well-being or our performance without us even realizing it? Something to think about. Thanks for joining us for this deep dive. Until next time, keep learning, keep questioning, and keep exploring.